Welcome to this week's episode of the Caregivers Podcast. I'm your host, Dr. Mark Ropeleski, and you can call me Dr. Mark. Last time Janice Martin joined us, we walked through the A to Z of what happens when a family reaches the point where care at home is just no longer safe and sustainable, and long-term care becomes a real possibility. But for many families, that's only where the harder conflicts emerge. The promise an adult child made years earlier never to put mom or dad into a home, it comes back. The siblings who don't agree on much, if anything. The caregiver who's so depleted they are no longer able to really think clearly. Today, we're going to delve deeper into the traps families fall into when long-term care is no longer theoretical, but a real looming need and possibility. Before we begin, please subscribe to the Caregivers Podcast on Apple Podcasts, Spotify, or wherever you listen. It's free, it takes just a second, and it's the best way to support the show today and for the years to come. Janice Martin, welcome back to the Caregivers Podcast.
Thank you so much. I'm so glad to be back.
We're really happy to have you here and to be paying a visit. We've had a really meaningful conversation in the past, and there's just so much more to flush out and to give our listeners any added tools or waypoints to help them navigate this challenging time when big decisions need to be made about our loved ones and whether they can still look after themselves safely where they are now and where they could potentially go.
Yes.
So we're always in the situation where we just hope for the best and sometimes find ourselves making promises we can't keep. Like, Can you, from your perspective and your experience, tell us why that question, promise me you'll never put me in a home, is such an unfair promise to ask of your loved ones when everyone is still sort of healthy and calm?
That's it right there. Those promises are made long before there's a problem, long before they've gotten to the stage where they are, that now they need care. And my question of families, when that comment was made years and years ago, and now today they're faced in that situation and they've made that promise to their loved one, my response is, would your loved one have wanted this for you now? Knowing where you are right now, would your loved one have wanted this for you without understanding the implication of the strain, the mental strain, the physical strain, the financial strain on you as a caregiver to not pursue other avenues to allow the others to help? And only one time did I have a daughter say, yes, my mother wanted me to be miserable. She always did. So that was the only time that comment backfired on me. But most people do acknowledge, yeah, it was a long time ago. And the other question that I have for them is, when was the last time they saw assisted living? They probably don't have familiarity with it. They probably are thinking of their mother's or their grandmother's nursing home experience, which was terrible. And today's assisted livings are so much different. You need to see it and experience it and understand what it is like today.
There may be some listeners today who are just embarking on this next phase, but haven't been asked to promise anything yet. But what do adult children actually usually not understand when they make the promise to their elderly loved one that they won't put them in a home?
Well, they don't understand the difficulty of it. They don't understand the reality of it, that this will consume them 24/7 for possibly for years. Can they sustain that? Can their own health sustain it? Can their own finances sustain it? And can their relationships sustain it? Because it's difficult on the family, the outside family as well. If that caregiver has a spouse or children, it's hard on everyone. And it's difficult to really appreciate the reality of it.
So what would a responsible adult child in that circumstance, when a parent says, promise me you'll never put me in a home, what should they say instead of making that promise that they may not be able to keep? Can you give them a safe script of how to at least start the answering process to that request for a promise?
I'd like to share with you how I approached it with my own mother. My mother said to me one day, promise me you'll never put me in one of those places. My mother was a very social woman. She always dressed well. She enjoyed cooking. She played bridge. She played mahjong. She was out and about. But my mother had vascular dementia and she was incontinent and she had trouble now using the remote, and she had trouble driving and more increasing trouble. And she said to me, "Promise me you'll never put me in one of those places." And my response was, "Mom, you are a beautiful, social, active woman. If you get to the point in your journey that you can no longer go to bed anymore, you spend your entire day in your recliner, you can't change the channel on the TV, that recliner may be soaked with urine, you're not eating well, you're not taking your medication well. I love you too much to accept that quality of life for you, because that's not the quality of life you deserve. And I would like to help you find a place where you would feel comfortable." And, it stopped her dead in her tracks. She said, "I never thought of it that way," because that's what I wanted for her. Not saying you have to do this or you can't live alone anymore. That's not going to solve anything.
It's really interesting. I heard something in what you just said, in that the parent said, "I never thought of it that way." And they may not know what's in store either. And some of
Yeah.
that request for the promise may be a little innocent, actually, just
Oh, it
not
is.
being aware. And then all of a sudden, as a child, as someone who loves their parent, you have that honest conversation. It's almost a shared educational moment. It sort of resets the parameters and maybe makes for a lot safer conversations in the
I
future
believe
as
so.
well.
I believe that it's important to include your parent in the discussion, in the decision, in the whole process, so that they feel that their power is not taken away from them. They do have a degree of control.
And I think that's important in every instance, that their voice is not suddenly erased.
The other thing that I've learned, if I may, is that almost everyone exclusively that I talk to feels like this is the final decision. We're going to move her to an assisted living and hope for the best, hope it's what she wants, and hopes they can give her the care that she needs. And it's never a dead-end street. You always have options. You always have choices. So let's try this for 3 months. That's it, because it takes about 3 months to transition. Let's try this for just 3 months. And at the end of the 3 months, we'll have a conversation together, perhaps with your doctor, perhaps with the care team at the assisted living, to determine what we feel is the best way to move forward from this point. Should we extend it longer, or should we look at other avenues? So again, they don't feel like they're trapped in this decision. It's done in stages.
Absolutely. Even, if you say you did a 3-month stint, well, during those 3 months, the little tweaks could be made in real time, once a week, have a brief
100%.
sit down and just sort of see how it can accommodate a little bit more.
Yes.
That promise, getting back to it, certainly can set the stage for a lot of guilt and feelings of betrayal later on among family members who made that promise to begin with. How do we best avoid that?
You have to come to peace with yourself that you are making this decision in your loved one's best interest. If it's not about you, if it's not a selfish decision, but you know that this is the best option to keep them safe, to keep them healthy, and to get them the care that they deserve, you must come to peace with yourself that your parent may get angry, and that's okay. I have found that the more difficult relationships that the adult child had with the parent, the harder it is for them to make this decision, because they've always been so afraid of making their loved one mad at them, or their loved one or their parent always got mad at them for everything they did and judged them for everything they did. It's important to take a step back and look at your adult relationship now. Do you need that validation from your parent to know in your heart that this is the right decision?
That's a huge, huge comment to unpack. But that whole issue of validation and understanding about what you may have needed once upon a time, and do you actually still need that level of validation now when you're making a decision that's in the best interests?
Yes.
And interestingly, it's not about a decision to betray a promise or betray your loved one. It's to realign care needs, and you can still be very present in the new environment, and you may actually be more rested and more capable of providing a quality of life as a child, as a son, as a daughter, as a partner in the new arrangement than you did struggling in the old. Do you see that
Oh, yeah.
often?
Oh, yes. I see it in myself. I saw it in myself with my mother. My mother was very difficult, and my mother, angry a lot, and I had to come to peace with my adult relationship with my mother. Let go of all of that and focus on the relationship that we had at the end of her life, because that was what I was going to remember the most. That's what I made a conscious decision to remember the most, was how we were towards each other when she did need care. And it was a beautiful relationship at that point. And I'm so proud of being able to overcome that and being afraid of making her angry with me, because her anger was very frightening to me growing up. But I had to understand that. But I also found that it was through honest discussions and saying, listen, things are different now. Things are different now than when we had that conversation many years ago. Let's talk about how it's different and how it can be beneficial to you.
As we start thinking about making changes in the best interests of things like safety and well-being of our loved one, and they need to start thinking about greater amounts of assisted care in their life, the first thing that sort of pops into one's mind is a dollar sign. And families start looking at assisted living or long-term care, and it can be pretty daunting.
It's very daunting.
And from our discussions previously and from some of my research, there's obviously, whether you're in Canada, across different provinces, or in the States, across different states or other parts of the world, there's different regional rules and regional offerings of what's compensated for, what's provided for, what needs to be paid for. And is there a sort of a baseline, and maybe we can use your example in Florida as a baseline, and acknowledging that there's some variability, but is there a baseline monthly cost that families planning this sort of transition should be prepared for? Then how quickly do the numbers escalate as needs go up over time? Like, is it sort of a couple of needs don't change or budge the needle very much, and all of a sudden, bang, it just takes off, and then people panic?
I recently downloaded a report on the cost per state in the United States of senior living. And I would say that the average for a studio apartment across the United States, an average, is about $4,000 a month for a studio apartment. But that does not include care. So you are going to have to build on top of that. I have found that price increases are going to happen pretty much, you can count on every year. Sometimes it's on the anniversary date of when they moved in. Sometimes it's the beginning of the new year. So that, a little tip, if you're moving in October or November, ask if you can be locked into that year's pricing for the coming year, so you're not immediately faced with a price increase.
Oh, that's a good
But
tip.
the price increase standard average is around 4%. I've heard of communities having multiple increases in 1 year, increases over 10%. And that's almost impossible for people to maintain. There's nothing in an agreement that I've ever seen that indicated that there would, first of all, ever be a cap, because they can't, or that there would be a maximum percentage. It all depends on the cost of gas, the cost of labor, the cost of goods. It's passed on to the family. It has to be, or the community can't sustain it. And it's hard to keep that in mind.
Well, and we're not exempt from inflation under those circumstances.
No.
But what are the big sort of momentous thresholds that individuals cross where we suddenly see costs of care go up? Is it needing help to stand, or not being able to walk certain distances, or is it incontinence or wound care, or where do we see the big jumps? So if people have an understanding of how they'll foresee what the base price is, and then what it may escalate to within a very short time.
Sometimes it starts at the very beginning. When an assessment is made, I found that the greatest disservice is when the families understate their loved one's care needs. So because they want to keep the cost down.
Right.
So they understate it. And then after their loved one moves in and the community understands, oh, it's a lot more than we thought of, and they raise the rate for the care, it's the family's responsibility to set this right from the very beginning. So if your price is going to jump quite a bit after 30 days, it's because it wasn't disclosed appropriately. But you have levels of care that range everywhere from verbal reminders, standby assistant, hands-on assistance. Each of those is going to have an increase in the amount of care that you're paying for. And likewise, I've also found that some things have nothing to do with care. The call pendant. I have had experience with residents who press it every 10, 15 minutes. They don't realize they're doing it, but they're afraid. They're afraid of being alone. They press it, they press it, they press it. Every time they press it, a care staff has to come off the floor to go turn it off and make sure that they are okay. That is going to increase your care needs. But the best way to manage everything is to do as much as you possibly can for as long as you possibly can, because the care staff is not there to do for you. They're there to support you in things that you absolutely cannot do. So maintain that control over that aspect of the care cost.
So do some facilities actually do an in-person assessment and not just rely on the family reporting? And would that be a better way to have a better idea of what the baseline costs are going to be?
In the States, we have to have a nurse assessment, or it doesn't have to be a nurse assessment, a professional assessment. I, as a director of sales, I was able to do an assessment to see if this person was appropriate or not. And what is important is to have the nurse or the person doing the assessment ask the individual to demonstrate what they can do. Because if the nurse says, "Can you walk without assistance?" and the loved one says, "Why, yes, I can," and then they later find out, well, maybe they can, but they can't get in and out of the chair on their own. We have to come and transfer them. If it's not demonstrated, it cannot be an accurate cost. We also have to combine that with a doctor's form. And the doctor's form has the clinical information. Are they independent of these care things? Do they need moderate assistance or do they need full assistance? And we combine those two things to create a care plan. And that is what the care fees are based upon.
So we can do a lot of upfront interrogation of the clinical scenario and really come up with a pretty accurate estimate of what it might cost. But if a parent only has a few years of money available for care, does delaying the move into a care facility actually help, or does it actually make things worse when the need is finally so obvious that you can't hold off anymore?
It's a difficult decision to begin with, and the transition is difficult on the person who is moving in. Sometimes I've actually found that they improve. They blossom because now they're on a routine. They're getting their meds delivered on time. They're getting better nutrition. They're socially engaged with other people, and they do better, much better. And I would want that for anyone that I love. But most people are afraid that they're just going to die. This is what it's going to take to make them die. And that does not happen. But if that does happen, it's not because you moved your loved one to assisted living. It's because you waited so long. And I encourage people not to wait so long, because the loss of their loved one compounded with that internal guilt, did I do this, is too great to bear. Try and do it before you get to that point.
So even though maybe trying to defer the move, hold on to some of the funds, let them get a bit more interest or what have you in whatever vehicle they're sitting in, the added decay at home may not allow the individual to benefit the most when they actually enter assisted living and have some better resources than when they were strapped.
True. And we can look at, are there financial options that are available to the individual through government programs or other family contributing? If you're only looking for a short while and there are family members that are willing to contribute financially, that's a good time to be looking into those avenues.
So when you start doing that budgeting and sort of forecasting as a family, you've got your loved one who needs to, make a big transition. Can you realistically plan for a certain X number of years, or is it just too impossible to plan for? And then what actually happens if the parent the loved one outlives the money that's there in reserve? What happens then in real life?
Well, to address the first part of that, how do you budget for it? I wish I had a good answer for that.
Hmm.
I think that you too many parents want to save their money for their children. They want to give it to their children and their grandchildren. So they don't disclose money that may be available because they don't want it to go away. You know, if you can approach this from this is what you work for. You worked to provide care for yourself so that you are not a burden to others. Not that anybody necessarily is a burden to others, but that is generally the feeling that I hear from people. They don't want to be a burden to their children. So you saved, you bought a house, you have the assets from your house, you have things that you can pull from that hopefully can be included in your monthly income that you get through Social Security, pensions, investments, and such. So if you can have an honest discussion with your children about what you actually do have, that's a very important thing to do. But what if you do run out of money? The number one question that I hear is, are they going to throw my loved one out on the street? No, they're not. A hospital, a rehab, a community cannot discharge anyone without a safe discharge plan. However, one thing that I have witnessed is if the loved one is in assisted living and they have to go to the hospital and they have not paid their bills for a number of months and there is no money left, the assisted living does not have to accept them back. So they could say they've moved beyond our scope of care, they've moved beyond our abilities, and we cannot accept this person back. Around in the United States, that individual would then probably go to a skilled nursing long-term bed under Medicaid, and then they are covered that way.
Right. You brought something up that really resonated. So how often do adult siblings actually end up fighting because one sibling views the house and the parents' assets as potentially a source of care funding, whereas another views them as the inheritance?
It happens a lot. It does. And I think that's the thing that makes me the most sad, is when there's that argument, when they don't see the value of providing care for your parent who cared for you for many years. I hear it quite often. And sometimes I hear children say to me, an only adult child, I have no siblings to help me through this. And I say, there's pros and cons to both. If you don't have other siblings that you have to justify everything to or explain everything to, that could be a blessing. But likewise, if you do have multiple siblings, as long as you're all on the same page, that can be a blessing. But it's a big challenge, and it's very sad when adult children do not see it the same way. But ultimately, if one of the adult child is making those financial decisions and they are power of attorney, it is their decision.
I could see how that could get really challenging.
It does.
So if adult siblings then are paying for a parent's long-term care, how do they negotiate? I mean, what advice do you give them to negotiate that sort of arrangement without the family getting completely destroyed and with conflicts and disagreements?
So your question is if the adult child is subsidizing the payment?
Yeah, I mean, it's tricky when you have to,
Yes.
someone is able to, but yet perhaps others may not be contributing as much, and it just sets the stage for potential conflicts in the future. Are there ways that you counsel families on how to have those difficult or those unique conversations so that they don't run into big conflicts later on?
I advise the initial person that I'm talking with to be realistic about their expectations, because the expectation may be that all of you are going to contribute equally when that's really not what's going to happen. You want it to happen, you expect it to happen, and then when it doesn't, that individual becomes very angry and resentful. So have a discussion with everyone. What is your expectation of what you can contribute to this? What is your expectation? And all have a solid understanding of what you're going to do. You can even write it down on paper. It doesn't have to be a legal document, but something that holds each adult child accountable for what their promise is to their parent. And then you do understand. So if that expectation is not met, it's not because you were unrealistic. It is because of that other child's failure to fulfill their obligations.
We're going to take a short break and hear, in the tradition of the podcast, hear from our production team who always have a couple of illustrious questions in store for our guests. We'll be right back.
I'm wondering, we were just discussing when adult siblings can't agree that either the money should be for inheritance or it should be for care. So when you're presented with a situation where the elderly parent, it's clear that they need care. They've crossed every point that indicates that they can no longer be at home safely by themselves. And yet the adult siblings are in sort of this conflict that could go on, I guess, for weeks or months. Take me inside of where and how you stand in the midst of all of that. Is it about waiting for them to figure it out? Or is it about sort of like approaching both sides of the argument? Is it, how do you negotiate that?
Well, I try to come in as a devil's advocate, and sometimes I do try and have a conversation, a Zoom call with all siblings to kind of mediate the conversation. But in my opinion, ultimately, if one of those children is the power of attorney, and that the power of attorney would be the financial component, it is ultimately their decision. They have to, that's why their parent gave them that power to make those decisions for them. And sometimes you do have to go against what the others are saying. And that's, that could be permanently damaging to the sibling relationship. But again, it comes back to, do you know in your heart that you're making this decision in your parents' best interest?
Is it common that people just sort of assume that they're all on the same page? And then when they talk to you for the first time, that's when the divide seems to appear. Is
Oftentimes.
money really the thing that it comes down to? Is it how often do you see that it's money that's really the divisive factor?
I don't see it really that often, but I do see it. Yes. Why does she need a 2-bedroom? Why can't she take a 1-bedroom and save some money for us? I want some inheritance. Well, this is her decision. This is what she wants. It's difficult for families. And that, again, we all have expectations of anything we do, what the result is going to be. And when it doesn't happen, the question is, was that my expectation, or was that me not being realistic, knowing the individuals that are involved? Because our expectations are sometimes different.
And this is so important that it seems like it could be the catalyst for maybe years of sort of buried resentments and conflicts that go back to childhood. And suddenly there's this big decision needs to be made. And is it really about what's happening in the moment, or is this about perceived wrongs that go back decades?
Especially if there was any kind of abuse from the parent and the children was like, she was never there for me. I am not going to be here for her now. And I do see that. I really do see that. The abuse, the adult children making decisions for a loved one who was abusive to them in any way, it's really tough to make good decisions.
Thank you.
So if I'm hearing things correctly, and this is really important for our listeners, is that when there is disagreement, the individual with the authority to make big decisions, what happens to mom and dad, is the person who has the power of attorney. And no matter how much squabbling may ensue and how many opinions may arise, they're protected by that piece of paper.
Absolutely. Absolutely. Unless they're all listed in the power of attorney papers, only one person, or sometimes two. Sometimes it may say daughter 1 and daughter 2, but oftentimes it says daughter 1, or in her lack of capacity to be able to do it, daughter number 2 can make decisions. So it is acknowledging the trust that was put upon them by their parent when they were of sound mind to make decisions in their best interest. It comes down to that.
With the challenges of family dynamics you allude to, I could just think of the tricky situation if you had a joint POA and one grew up as the scapegoat and one grew up as the favored in the family. You can imagine that would be a recipe for disaster.
Oh, yes. It really can be.
So if I'm hearing things correctly with your experience working with hundreds of families, it doesn't happen very often that what happens to mom and dad is driven by the sibling most focused on preserving the money and the inheritance, but rather the other way around. It tends to be more often still the needs that make and shape the final decision.
Yeah. It's the needs that shape the decision. Yes.
Well, that's good to know, and that's reassuring. It kind of gives a little bit of faith in humanity, doesn't it?
Hopefully they come to the decision on their own before they destroy relationships.
Is being the power of attorney or healthcare decision maker often a thankless job these days? And what kind of pressures and blames and second guessing sort of do individuals put on themselves and end up carrying, for and from the rest of the family?
Usually from families, they understand the role that they've signed on for. The problem that I see is when an older adult does not have children and they don't have anybody to entrust this with, and they ask a friend to do it, and that friend has no idea the level of the commitment that they're making to that individual. And sometimes adult children don't either, but I see it more from people who have no blood relation, or they're just a friend. I'm just a neighbor. I didn't sign up for this. I'm 80. I don't want to be doing this now. That kind of response. I want to live my life, and now I'm spending all my time, trying to figure out her care needs and what she needs. So it depends on who you are, what your relationship is with that individual. And also, I'm seeing adults or seniors in their late 90s. Their adult children are in their late 70s, and they don't have good health to be able to do this. They didn't realize that their parent was going to live this long and that they were going to be in need of someone helping them as well. And now they're with this responsibility. Now, power of attorney papers can always be changed at any point, but as long as the individual who is assigning this power is of sound mind to do it, if it needs to be changed, it can be changed.
It's interesting over my career, having sat with so many patients exploring different parts of their well-being outside of their immediate physical symptoms, but how those parts of their well-being can affect their physical symptoms. I'm amazed at how many of my senior patients are actually caregiving for friends who have nobody.
Yes.
It's not an insignificant number, and it can be just as draining as though you were looking after a loved one.
I find it more draining.
Why is that?
Because they haven't had, most often, a lifelong relationship with this individual. It's only been, maybe 5, 10, 20 years. And it's quite eye-opening to them. They don't have that longevity.
So what happens then when an elderly parent clearly needs more care, refuses it flat out? Meanwhile, it's really not safe for them to be at home. Even as the power of attorney, can you then enact some sort of help for an assessment or something that'll push the agenda in a direction whereby actually, for the safety of the patient, they have to be forced into some assisted living? Like, do those situations arise? Or
we can't do that unless the individual is going to memory care. The person moving to assisted living has to agree. You cannot force them. Memory care is a different beast altogether. It's in a secure area, and that individual is not able to make decisions for themselves. But as long as somebody has the capacity to make decisions, you cannot force them. But again, I go back to, this is not an all or nothing conversation. Listen, we need to make some modifications to the house, and we don't want you to be here while we're doing that. Let's go to assisted living for a few months while we can make those modifications, and then see if it's safe for you to come back home. Or it could be, You're falling a lot. Let's go to assisted living, get some outpatient physical therapy while they're providing the care. And then when your therapy is finished or you've improved, we can have the discussion if you can come back home. Now, this, of course, depends on if the house is paid for. If you're still paying a mortgage, that's not realistic to be able to absorb the cost of a mortgage and all of those fees on top of the assisted living community. But if you have that luxury that you don't have to pay for your mortgage or rent, then you do have more options available to you. But again, even if they've sold their house and they have no house to go to, there are other options. We could look at other assisted livings that might have more activities for you, or other assisted livings that have a higher level of care or cost less, or whatever could be the objection that arises over the time that they're there.
So when we're looking after our loved ones, we're not looking, their lives are not in a vacuum. They may carry certain habits that have followed them over the years, and that can include elements of difficult personalities, alcohol or substance dependence, or
Yes.
behaviors that just make placement difficult. How do long-term care communities at various levels sort of assess and handle and screen for residents when these features creep into the discussion?
There's a thing called resident rights. If a person is a diabetic and they're living in assisted living and they want pancakes for breakfast and they want 3 rolls with lunch and they want cake with dessert for dessert at dinner, it is their right to have it. The assisted living cannot say no. They cannot. They can offer alternatives. They could say, listen, I understand, that there is some concerns about your blood sugar. How about having this for dessert tonight? Or whatever they can do to steer them around that request. Likewise, if they're an alcoholic, if they want to drink, they can drink. They can absolutely drink in their apartment in assisted living. We cannot force them to not go out. If it's a doctor's orders, sometimes you can get around it, but not always. So if the doctor says this person needs to be on a low carbohydrate diet, you've got a greater leg to stand on. But the alcohol, the substance abuse, they can still do it. That's their right to be able to do it. Memory care is a different story. You can modify or monitor it there.
So they have a right, but what's that line that has to be crossed where they are inflicting harm on themselves or other residents because of their behaviors?
In Florida, it honestly doesn't matter. I had a woman that I was helping. She moved her father, it was her husband, to assisted living. He was diabetic. His A1C, his glucose was through the roof. And the response from the community, and it was the right response, not what we wanted to hear, we cannot tell him no. So the only option that she had was to pay for a very expensive drug to bring his sugar levels down. Very expensive. Very, very expensive.
Mm-hmm.
The only option she had would be to move him to memory care. You have to have a diagnosis of dementia to go to memory care. So just because he's not cooperating, he's making poor decisions, but doesn't have dementia, you can't make that move.
So just to probably have some new listeners today, when we speak of memory care, is that just built-in safety mechanisms, recognizing that people who have trouble remembering may find themselves in harm's way? Or is that actually a more active care program where memory reinforcement exercises and there's a sort of a styling of engaging with the individual that reinforces memories and or creates opportunities to work on things cognitively? Is that what they're paying for, or is it just vigilance to make sure they stay safe?
So memory care is a specialized neighborhood within an assisted living. It's a special part of the building that is secure, so the individual cannot leave on their own without an escort because they are at risk of elopement, or also known as wandering. But there are different activities that are scheduled for them. The activities have fewer directions involved with it. So in general assisted living, they may be doing something that there are 5 different steps to the directions. Well, someone with dementia may not be able to do that. So the activities that they're doing in memory care may only have 2 steps, and it makes them feel more successful. There is more hands-on care. It's not more care, but it could be a higher level of hands-on care to the individual than general assisted living is. So memory care is assisted living. It's just a specialized area of
Like an
assisted living.
adaptation.
So
Yeah.
if an individual has wandered, if they're at risk of walking away on their own and not knowing where they are, they must be in memory care. If they are isolated because they can't keep up with the group or they can't find their way to the dining room, memory care may be an appropriate option for them. But there are many people in general assisted living who have a degree of dementia, and they're well supported, so they are successful.
So value in that.
Oh, there is definitely value. Yes.
Is it a dramatic increase in price? I know some individuals are concerned about the cost of memory care. Is it out of reach for many with dementia?
It's different. So if you were let's say you're in a studio apartment in general assisted living, and you have a small kitchenette there, and you may have a private bathroom with a shower in it. If you move and you're paying for care, you're paying for your room and your care, oftentimes, but not always, memory care is all-inclusive. The care is bundled with the room rate. The room is smaller. There's no kitchenette because they're not doing any cooking any longer. There may not be a shower in that room because most people in memory care don't take a shower on their own. So they may be using a shared shower or whatever, but it's going to be different accommodations that are, at the end of the day, are going to be the same cost as what they were paying for a studio apartment with care.
So we talked a little bit about how things are adapted to certain individuals who make choices to drink, for example, or consume different substances, etc. And these are all adults, and these are individuals who are responsible for their actions. But we've heard more and more recently reports about consent and intimacy among our seniors, and even sexual health and outbreaks of sexually transmitted infections. Are these conversations that families are prepared to have with their loved ones? Like, what are mom or dad going to suddenly start having sex again in the care home? I mean, it sounds blunt, but families may not be prepared to deal with sudden conversations that are imposed on them if there's concerns. I mean, there are public health issues. There's all kind of different layers which we're not prepared necessarily to explore, but they sometimes come to the forefront. What have you witnessed?
I have dealt with this a few times, and it comes down to consent. As you said, we are all adults. They are adults. Whether the children want to recognize their parents' sexuality could be their issue alone. But if the adult is consenting to sex and it's agreed upon by both parties, it's their right to be able to be intimate. People in assisted living, they can have folks stay overnight. They can, go out, and they could go out to dinner. They can have a girlfriend or a boyfriend come and spend the night with them. That's perfectly fine. But the real concern is memory care. And that is an extremely delicate situation to be discussing. But I had just an awful situation with a husband and wife. His wife was in memory care. She couldn't even verbally express herself at all. And he would come to visit and essentially force her to have sex with him while he was there. We did not realize that, but every time he left, she was uncontrollably sad and agitated, and we didn't understand why. When we did, I had to have the conversation with the adult children. Your father is not allowed to visit your mother anymore unless you accompany your father. It is affecting her emotional and physical well-being, and we are not going to accept that for someone who is entrusted to our care. So I put the decision back on the children, who were appalled at all of this, but they understood, and it was an honest discussion that had to be made. So sometimes it's not in the individual's best interest, but they deserve privacy. They do deserve privacy as long as there is consent.
It almost sometimes strikes me like there's a second wave of sex ed classes that are needed for seniors entering an environment where suddenly, they may not have thought about it for decades, but there are public health issues.
It sounds like you're talking about the Villages, Florida, where I am near. And let me tell you what, that's like an adult playground for seniors. Oh, we're not even going to go there. But it's true. Sometimes when you get older, if you find yourself that now you don't have a spouse and you find someone that you find companionship with in the community, that's very special. We all deserve to have love and companionship and intimacy at any point in our lives. I have had residents where I worked, they met at the community and they got married at the community. And it's a beautiful thing. And I want people to know that you can still find joy. You can find love in assisted living. For the adult children, it may be difficult for them to accept that their parent is sexual, but they need to take a closer look at their own lives and themselves and what they want for themselves when they get older.
Sounds fair to me.
Me too.
There comes a point where family caregivers just sort of hit the wall. And I always wonder, how does a family caregiver really know that they're no longer just exhausted, but life has become unsustainable and they just can't meet mom or dad's needs? What signs do you witness in others that really tell you that they've crossed that line and that big decisions need to be made, or the caregiver's at risk of really getting sick?
I just helped a woman move her husband to memory care, and he was very advanced with his dementia. And I was able to help her get her husband on hospice. And she was not sleeping because her husband was up all night. She was absolutely as close to a full burnout as anybody I've ever witnessed. And the nurse and the social worker from hospice had an intervention with her and said, if you continue in this way, it will kill you. You must do something for your own sake and for your husband's sake, or he's not going to have anyone to care for him. And thank God somebody recognized that and really had a good, heartfelt conversation with her. And it helped tremendously for her to have an outsider's point of view. Sometimes if it's our children telling us that, I know what I'm doing, I'm okay. But, you talked about the effect on your physical well-being. When your immune system is under stress, your body is under stress, your immune system shuts down, your cortisol levels off the chart one way or the other, and your health suffers. What is going to happen to your loved one if you are not taking care of yourself? You must. And we put ourselves as caregivers last, always. I'll go to the doctor next week. I've got to do this, or I'll take care of it later. I can't afford to take the time to do it. We have here mobile doctors who come to the house. So you don't even have to be housebound or whatever. They will come to you and you pay the same as going to a office visit. So if you can't leave your loved one for even a minute, maybe you could bring in these services to have the doctor meet you in your home.
You really hit the nail on the head there, because I think there's a fatigue that comes from being on the go and, really having to work hard to find little pockets of time for yourself to keep your identity in balance as a caregiver. But when sleep deprivation enters the equation, and we're not talking about, a bad night here and there.
Oh, right.
It can get to the point of every night predictably is a bad night and it will go on in perpetuity.
Yes.
That takes the physiology to the next level.
It sure does.
And I think there's lots of good research evidence in terms of sleep physiology and the impact of sleep deprivation on our physiology that really becomes unsustainable and dangerous, probably to self and even the care of the one you love.
Sometimes I have a conversation with the caregiver. What would have to happen for you to recognize that you can no longer do this? What do you feel is your line in the sand? I can't do this anymore. And to have that conversation with your children, with your pastor, with your church members, somebody that you trust, because when you do get to that point, the natural inclination is to say, oh, it was just this one time. I could just do it a little bit longer. I'm going to wait for X to happen. But if you have that conversation in advance, then that person can come back to you and say, listen, we talked about this, and this is what you had shared with me would be the time that you knew you had to do something. So maybe now is the time that we need to be talking about going to the next step.
In the end, how do family caregivers get past the feeling that moving mom, dad, or their partner into long-term care is and was, if they're looking back, a one-way ticket, and that it truly betrayed their wish to die at home? What advice would you say to people who are, grappling with those feelings and just knowing that they had to facilitate the move, but just having that gnawing sense that they betrayed their loved one consume them? What advice would you have for them?
I always come back to prayer. Pray on this. Pray and ask for guidance. What is the right decision for you to do? And don't use your own internal feelings to come to your conclusion. Listen to the voice of God. Listen to what other people are telling you. Listen prayerfully and let it settle in your heart so that you know that the decision that you are making is in your loved one's best interest. And if you know that you are doing it from love because you feel that this is the right thing to do, hopefully at some point you can forgive yourself for any guilt or ill feelings that come as a result of the move.
I couldn't think of a more peaceful way to conclude today's episode, in that sit with yourself. It may be prayer, it may be a form of meditation that's unique to you, or one that you've learned and that you practice, but that helps position yourself amongst challenging emotions and thoughts, but that you did so with the best intentions, and that there's strength to be gained from knowing that.
Yeah. And find support. Once your loved one has moved in, there are often support groups of families that are going through the same thing. And find support from other people too, so you know you're not alone.
Well, in this day and age where loneliness and feeling that we are all islands alone is rampant, this keeps coming up episode after episode, no matter what topic or what guest. But find the village around you. Find a small network. It doesn't have to be massive, but just look for the support, and it's there. And there are probably other people looking for the same support at the same time.
And that's that you use the word look for. They're not going to come to you. You have to seek it out. And maybe, hopefully, someone recognizes your struggle and approaches you with a solution. But if they don't, search it out for yourself.
I hope that our listeners today, if any of these parts of the conversation triggered some interest, to come back and listen to the full episode. It's a really rich one, and we hope that it makes this challenging transition in life a little bit easier for everyone. Thanks for joining us today, Janice. It's been a pleasure once again, and we wish you the best. And that wraps up this week's episode of the Caregivers Podcast. I'm your host, Dr. Mark Ropeleski. You can call me Dr. Mark. We'll see you next week. If this conversation today hit close to home, I hope it's also helped make some of these impossible feeling decisions a little bit clearer and a little bit more within reach. Janice, thank you so much. Thank you for helping us speak to the parts of long-term care families are often afraid to say out loud. And if this episode meant something to you, please subscribe to the Caregivers Podcast on Apple Podcasts, Spotify, or wherever you listen. It's free, takes just a second. It's the best way to support the show. We really appreciate your comments and suggestions. We'll see you again next week. Before we wrap up, I wanted to remind you of something important. The conversations you hear on this podcast are here to inform, to support, to spark reflection. They're not a substitute for professional medical advice, care, therapy, or crisis services. Listening to this podcast does not create a doctor-patient or caregiver-client relationship between us. If you're facing a medical concern, health challenge, a mental health challenge, or a caregiving situation that needs guidance, I encourage you to reach out to a qualified professional who knows your story. If you're ever in crisis, please don't wait. Call your local emergency number or recognized crisis hotline right away. You deserve real-time help and support. The views you hear on this show, whether from me or my guests, are our own. They don't necessarily reflect any organizations we work with, or are part of, or have worked with, or been part of in the past. This podcast is an independent production. It's not tied to any hospital, university, or healthcare system. Thank you for being here, for listening, and most of all, for taking the time to care for yourself while you continue to care for others. I look forward to hearing from you.